Hello, everyone, and welcome back to the show. I'm your host, Levi with Mailbox Money here in Sioux Falls. And joining me today is Echo Kopplin. Echo works in healthcare, education, and advocacy, focused on improving how clinicians are trained, supported, and positioned to serve patients in a changing system. Echo, welcome to the show. I'm glad you're here.
Thanks, Levi. I appreciate this opportunity. This is wonderful. And thanks for pronouncing my name right. You did a great job.
Thank you. I take it. I try to get that down. I'm not always perfect on it, so I take pride when a guest acknowledges it. And thank you. Would you mind, Echo, telling the people first where you're coming to us from, and then giving us some of your personal background?
Sure. Hi, everyone. Yes, I live out in Spearfish, South Dakota. We've been here for about 3 years now. My background, I grew up in north central Nebraska on a ranch. In Springview is my what I consider my hometown. We moved around a bunch, but that was where we lived the longest. So grew up on a ranch there. I went on to college at Augustana in Sioux Falls, and so kind of became a South Dakotan and
Very
met my
nice.
husband who's from the Black Hills. And then we both went on to graduate school. He finished his doctorate, I got my doctorate, and we ended up in Spearfish for our jobs.
Very cool. What was that? Was that there a lot of discussion being from Nebraska going there? Have you liked, the Black Hills area, west side of the state? What was that discussion like?
Wanted to practice in rural medicine. That was kind of my
Mm.
goal going into PA school. And so it really didn't matter where. I didn't have any strong ties to a specific state. But when you think about rural areas, you're not really just going to go to the East Coast or the West Coast. It's most likely going to be in the Midwest. And yeah, Nebraska or South Dakota was always kind of our draw, is where we wanted to go. My husband's a professor. So when we had those discussions, it had to be close enough to a college or university, but also still rural enough to fulfill both of our needs in those rural communities.
Very good. I think Spearfish sounds like the perfect fit for that then.
Yeah, it has been.
That's amazing. Before we start recording, you mentioned you had a graduating class of about 30 people, I think. So what's it like at the big city, Spearfish, compared to what you grew up in?
Yeah, so my high school graduating class was nine. So the
Oh,
30
the
was
class
30
was.
in the high school.
Oh,
Yeah.
wow.
So, yes, very, very small rural community. This is a big town to me. People think Spearfish is rural or small, and we fit for Lawrence County the um, HRSA requirements for rural metrics. However, it's a big city to me still.
Very cool. Well, Echo, a lot of people when they hear PA, physician assistant, they don't fully understand the training or role. Could you put it in simple terms what it is that a PA is and what makes the profession unique?
Yeah, I think that's such a great question. And the reason I think we're talking today is because of my passion about educating people about PAs. There's a huge misconception about what we do. And I think a lot of that stems from our name. So you mentioned it. Thank you for saying it correctly. It's physician assistant in legal terms. There's no apostrophe S, there's no S between physician and assistant. We're not possessed by anyone, we are our own profession. And actually, we've changed our title to physician associate on a national level.
Okay.
So in the language that I use today, I'll just say PA, but physician associate is what we're really moving towards. Currently in state of South Dakota, it's still physician assistant. So, what do we do? Well, I had to go through a bachelor's degree. So, my bachelor's degree at Augustana, I graduated with 156 credits in 4 years. So, to graduate, most bachelor's degrees require 110 to 125 roughly credits. So, you get your bachelor's degree. It's typically in pre-med, a science of some sort. And then you proceed to your application process. Getting into PA school is very rigorous. The acceptance rate is around 7%, which is identical or even a little bit more stringent than medical schools. That's simply just because of the number. There's a lot more medical schools available. So for the number of applicants, they're able to accept a few more smaller amount of PA schools, right?
Makes
But the
sense.
acceptance rate, so it's very difficult to get in. You do have to take an entrance exam. There are significant requirements, GPA requirements, all of those things. It is a master's level degree, so a PA master's level degree, and this includes typically 2 to 3 years of full-time work. You are discouraged from having any sort of outside employment because there's not enough time, the rigors and the demand. So it's typically a year to 18 months of didactic work. That's classroom work. So you are
Okay.
full-time in the class, 8 to 5, and then you go on and do a year to 18 months, depending on the program, of clinical work. During that time, you're in training that is rigorous. I was doing 80-hour weeks sometimes, but going every month. I was in a different location, a different specialty. There are about 6 core specialties that you have to do a rotation in, and then there
Okay.
are several opportunities for electives. But you train in every part where the PA comes out and is ready to sit for the national board exam with a generalized experience and training in medicine.
Very cool. So it's much more involved, I think, than a lot of people think right
That's
offhand, right?
exactly what I hear all the time when I was working with legislators last year. I'm educating them, and it comes back to our name is a misnomer.
Hmm.
Truly, we are able to see patients, diagnose, treat, manage everything from birth to grave.
I'd love to hear, kind of before getting into the working with legislators and the government and things like that, what initially got you interested in becoming a PA?
So I have a personal health history. I have osteogenesis imperfecta, also known as brittle bone disease. And so I have been a patient in the healthcare sphere my entire life.
Hmm.
Growing up in a rural community, we didn't have a whole lot of resources. We had to often drive 90 miles for healthcare. Um, we were cared for by a fantastic PA that I still love and respect to this day. And so, absolutely, he gave me the encouragement and showed me what a PA could do and how they can serve those rural communities, especially for someone who has a rare condition, something you might consider an invisible disability. Um, and that just gave me the courage to go on and to be able to be a PA. And then when I was seeing kind of these misconceptions and I couldn't
Yeah,
believe some of the things that were being said about PAs. And I'm like, no, I have to set this right.
that's awesome. That the a lot of times, the best way of going about something is uh, when you are personally affected by it, and certainly sounds like you've taken the ball and ran with that. So getting into what is some of the kind of the gaps that you're trying to fix, and how is it that you are communicating with government officials and legislators to get those changes made?
Yeah, the major gap we were actually able to rectify last year. So we were able to pass our PA Modernization Practice Act in 2025. And what that did was allow PAs to practice at the highest level of our education, training, and experience. So it really got rid of some of the administrative burden, some of the red tape that is around PA practice. That was a significant hurdle, something that some states still have not been able to achieve. And
Oh,
so
really?
that was fantastic. As part of that, it required a real grassroots effort prior to the session. So, starting in around, well, really, January of 2024, we had a PA day at the Capitol where we were just at the Capitol trying to be present, trying to educate legislators about our role, what we do, and how we can fulfill the needs for patients that have lower access to care. Then fast forward a little bit, June of 2024, we were able to see who had kind of made it through the primaries. So we knew who was going to
Uh-huh.
be potentially serving. And we started our grassroots efforts. I was in charge of everyone West River. And so I was reaching out to everyone who could potentially be in the House or the Senate in Pierre in the spring of 25. And I made contacts. I had coffee, I had dinners, phone calls, emails, Zoom meetings to really have those discussions and just say, hey, this is something we're interested in. Like, what are your hesitancies? What are your concerns? Can I share with you some education? It's a lot of cold calling. It's a lot
Yeah,
of
I believe
it
that.
being anxious, being scared. But I went to a lecture at one point in my career that was like, if you're scared, do it scared. And so you just do it. And it has really given me the opportunity to be better at public speaking and to work
Yeah,
on those connections and just relationships and build relationships with legislators, which has been really fun. I wrote a reflective article and it will be published in the Journal of Medical Regulation here later this year, which is just
amazing.
really exciting to be able to share, like, here are the things that I learned about advocacy and how it might be able to apply to you. Because regardless of what sector, regardless of what discipline you work in, if not you, then who? Like, who's going to be advocating for you, for your profession, for your patients? If you're not doing someone has to pick up the slack, and that
Hmm.
slack isn't always going to be enough to make an effective change. So we all have to kind of rally together.
In a kind of more general sense, now that you've gone through that process and walked through something that you weren't comfortable with, what kind of pieces of advice for someone, again, in a more general sense, that wants to reach out to officials and make a change? What are some kind of the starting points that you would give them on that?
Yeah, I think the first point is figuring out how to contact them, right? It's wonderful. We have a great sdlegislature.gov gives you all the emails to anyone who is currently serving. So you're able to find that. I think in the subject line of any email, you should say whether you're a constituent or not. I think that holds a lot of weight if you're trying to speak with your legislator specifically. And then in the conversation, whether it's the body of an email, a phone call, whatever, you should say who you are. You should say why you're calling. What is your why? That matters quite significantly because your perspective, your experience, it holds value. And then you can always listen because legislators do have their own reasons for running. They have their own interest items, and maybe you're able to support them or help them along the way. So if you can listen or ask those curious questions about what their goals are, what their priorities are that session, that can really open up the door for conversation. And then at the end, I think it's always good to like reiterate and ask. So I just want to get coffee with you so we can sit and talk about these healthcare specific issues that I find important for our district. Other ways you could just kind of follow up with, I'm just interested in your support for this. I thank you for your consideration.
Hmm. Very cool. That is great pieces of advice. Um, Obviously, you care a lot about mentorship models and preparing clinicians to lead, not just practice. Why is that so important in today's healthcare environment?
We are in an era of a continual workforce shortage.
Mhm.
And part of that is the system that we have created. So we are as clinicians, we work for the insurance companies, unfortunately. What we need to do is a healthcare reform, but that's a whole nother topic and a whole nother discussion. So
That's a
when we're
big can of
thinking that
worms there.
yes, so when we're thinking about the workforce shortage, we need to figure out how to make it sustainable and how to bolster our current workforce. And part of that is mentorship, part of that is training, because I wouldn't be where I am today without someone who went before me, without the PA that I grew up without all of the preceptors that I had on the 12 rotations I was able to go on, with all of these people who have kind of given some of their time. Often it's volunteer. Most preceptors are not getting paid for this.
Yeah,
And so having that opportunity to be able to mentor, to feedback, and to support the workforce that we currently have.
amazing. What is kind of maybe something in the near future slash some lofty goals that you are hoping to accomplish coming up here?
Yeah, kind of related to that. So I'm adjunct faculty within the Doctor of Medical Science program at the College of St. Scholastica. And one of the courses that I am helping with is the clinical practicum portion. So, what we're talking about here is just that importance of preceptor sustainability, of giving some sort of recognition, making sure that there's a release availability so that it's not, I'm seeing 40 patients a day and I have to work with this student and I have to teach. And then I also have a family commitment and I also want to be a human being, right?
Yeah.
So, how do we kind of support these people that are already taking on the mentorship roles, already taking on the preceptor roles? So that's one of my goals is to try and work on some sustainable, some scalable models to help reinforce our workforce. I would say that's one piece. The other piece is that healthcare reform. Like, how do we improve healthcare? Because I don't think that anyone would disagree that our current system is broken. There's so many patchwork pieces that have been put
Hmm.
with good intent to the system that have really just made it more difficult. And as a patient and as a clinician, I have seen that over and over again. So we need to find the people who are interested in transforming that and to work on ability to make it scalable, sustainable, and something that truly can help our patients rather than hinder the care that they are looking for.
If someone wants to learn more about what you're doing or hear more on the advocacy that for PAs, where would you send them to connect with you and to learn more, and if there's anything that they can be doing?
Yeah, connect with me on LinkedIn. I would say that's the primary place that I like to be and share what I'm doing. As far as the South Dakota Academy of PAs, we have a SDA PA website that you could certainly check out if you're interested in the PA realm. And then nationally, the American Academy of Physician Associates, aapa.org, is the kind of space that you can see some of the specific advocacy goals that we work on a federal level.
Amazing. Well, thank you so much for your thoughtfulness that you brought to this conversation. Healthcare is something that affects all of us, so it's helpful to hear from someone working to improve it from the inside.
Yeah, thank you for having me. This is just a really great opportunity, and I appreciate all that you do to showcase that people are really working hard for South Dakota.
Of course. Well, thank you for the kind words, Echo. We we appreciate your time and appreciate everyone's time for listening. We'll see you guys on the next one.